Okay, we should get started.
Okay, let's get going. Hey, everybody. Thank you so much for joining this call or this Zoom. I'm Anna Scott. I'm a reporter for KCRW. I'm going to MC this call today. This is the second community conference call put together by the United Way of Greater LA's Everyone In campaign. And the basic idea is for you to hear some updates directly from people involved in the pandemic response as it relates to homelessness. So officials with nonprofits, the county, and the LA Homeless Services Authority. Hopefully it will flow like a panel discussion or actually like 3 mini panel discussions, but that is a little hard to do with this Zoom format, so we're gonna do our best. We've gotten hundreds of questions in advance of this call, so we're also gonna try to answer those as part of it. Also in the Q&A box, if you're following us on Zoom, we're gonna put some answers there. And you can ask questions in the Q&A box during the call. We'll try to get to those in real time or after the call on social media. You can find that at the bottom of the screen if you're on Zoom. There are going to be 3 parts to the conversation today. So first is an update about what's going on to protect people experiencing homelessness from contracting the coronavirus and what's happening to assist people who already have it. Then we'll be talking about what's going on to try to prevent more people from becoming homeless during this pandemic. And then finally, what people can do to help. I know there's a number of people on this call who are specifically interested in that, so there'll be a chunk of time devoted to that as well. And for each of those sections, I'm going to just start with a question to each of the panelists. I'll ask the panelists to please keep your initial responses to about 2 minutes, just so we have time for everything. And then hopefully they can have a little back and forth between them. And we'll try to get to as many questions in the Q&A box as possible. So diving right into the first mini panel, what is going on right now to protect people experiencing homelessness in LA during the pandemic? There are more than 24 people who are homeless who have tested positive for the virus at the last count that I saw. So this is very urgent. And I want to start with Meredith Bergson. She's the Director of Policy and Systems with the Los Angeles Homeless Services Authority, or LAHSA, which is the lead agency for homelessness in LA County. Meredith, could you give an overview of just what's going on this front? And maybe can you start with the big effort to get people into hotels and motels?
Absolutely. Thank you so much, Anna. And thank you all for being on the call today. I am excited to be joining this call for the second time and to report out on the amazing work that's happened over the past couple of weeks. So Anna is right that as of Wednesday, there are 28 confirmed positive COVID-19 cases amongst people experiencing homelessness. While we know testing continues to be limited, and that's likely an underestimate, we can in part attribute that low number to the amazing work that's been happening to bring people indoors and to educate folks who continue to be on the street while we stand up sort of more opportunities for people to come inside and self-isolate. So I want to shout out to the outreach teams that have been on the streets going out to encampments and to folks who are sleeping outside to educate them. We know this has been an extremely difficult time, as many of the places that people went to access internet, to plug in their phones, to get meals, to take respite from the outdoors have been shuttered, and that has had an immense impact on our ability to communicate with our most vulnerable neighbors. So our outreach teams throughout the county, both LAHSA's, the Los Angeles Homeless Services Authority's homeless engagement team, but also our amazing nonprofit partners like LA Family Housing, have been going out and educating folks on the streets about COVID-19, about how to stay safe, have been distributing personal protective equipment to individuals. So that effort has been front and center. We have our access centers throughout the county continuing to operate to serve as another door to our system to connect people to the housing resources that are available. And then we've been working alongside our Department of Public Health partners and Department of Health Services partners to ensure that all of our congregate shelter sites throughout Los Angeles County are safely decompressing. So getting to what we call the 6-foot rule, but essentially spacing beds further apart so that the risk of community spread in those settings is mitigated. And then our biggest effort and what I'm most excited to share about is Project Room Key, which is our effort to work with hotels and motels throughout Los Angeles County, work with the County of Los Angeles and the state to stand up 15,000 of these units across the county. As of this morning, actually the slide that's in the deck is a little bit outdated, and that's part of what I love about this crisis is that things are moving so quickly, and our efforts to bring more housing online is moving faster than it ever has before. So we've secured 2,244 units across LA County. We're partnering with 16 nonprofit partners, again, including LA Family Housing on the call. We have a current RFI to partner with more nonprofit partners to be the homeless service expertise on site at these motels. And 583 people have already moved into these sites, with another 700 out of 750 that are currently online. Over the next week, we're going to be bringing on the balance of those units that have been secured, and we are continuing to beat the pavement, reaching out to hotels and motels throughout the county so that we can bring as many of these vulnerable folks inside as possible. And just one last note on Project Roomkey. I mentioned it, I think, the last time I'm on the call, but this is really for the most vulnerable amongst people experiencing homelessness, for people who are either 65 plus, asymptomatic, so they're not currently COVID positive. And I think Ian from OEM will be talking a little bit more about options for people who are symptomatic amongst the population. But this is for this Project Roomkey 15,000 sites are for people who are asymptomatic, experiencing homelessness, either 65 plus, or have one of the health risk factors, the chronic illnesses that make people especially susceptible to really adverse consequences from contracting the virus. So again, it's critical that we move as quickly as possible to move people indoors, and we are doing that. And I'll pause there.
Yeah, you mentioned Ian Watt, who's coming in next, who's with LA County Strategic Initiatives. He's been leading the emergency response to create medical sheltering. And as you were just referencing, this is separate from Project Roomkey, an effort to get people into hotels and motels, which can be a little bit confusing. So Ian, could you just start out by explaining that, and then talk a little about how quickly you're able to get people tested and into medical shelters?
Yeah, absolutely. Hi, everyone. Thank you so much for having me. My name is Ian Watt. I'm with the LA County Office of Emergency Management, and the mission we're running is we're calling a medical shelter mission. So it's a sub-hospitalization mission where we're using hotel, motel sites as well as recreational vehicles to allow people who are unable to safely isolate or quarantine themselves to be able to do so across LA County where needed. We have at this time about approximately 900 units geographically spread out across the county that are available to homeless individuals and others who may not be able to isolate or quarantine. It actually does not require a test. We are taking COVID positive people. We are taking symptomatic people who are referred by our outreach teams, by law enforcement, or by shelter providers, as well as medical providers, as well as people who are high risk and showing symptoms. So we love when we get people who've been tested because it allows us to, monitor their care accordingly. But we are able to take people who are only symptomatic because of the challenges in testing and getting testing to the entire community. So at these sites, we're partnered actually also with LA Family Housing, who's done an extraordinary job at the site they're working with. We have 6 sites stood up. We're working with a number of FQHCs and others. We have medical care on site. We have client services on site. We have DSWs, disaster service workers from the county. So these are people who work in regular county departments and have been detailed to support this mission by providing site management logistics support. We're working with LA County Fire, who do the logistics to ensure safe operations of the site, to ensure they're set up in cold zones, warm zones, and hot zones to make sure that everyone has adequate PPE and are working in the right areas with the right protections to keep everyone safe. So it's been a really unprecedented effort. Again, speaking to what Meredith mentioned, the stand-up and coordination across the county and with some of our private partners has been both unprecedented and just extraordinary to be a part of with the speed that it's happening and the service. We've served almost 400 individuals at these sites. To date, we have about 190 clients across our sites as of this morning. So it's continuing to be a resource, again, in both protecting the individuals as well as protecting the community from further spread.
And what's the goal with the total capacity that you think you'll need?
So we currently have 900 sites. We had set a goal at the beginning of March of 2,000 units. We're continuing to monitor to demand in terms of scaling up to that number and making sure that we use the available sites that we have right now, and that those are scaled appropriately and the beds are available. There are a lot of wraparound services needed, including things like cleaning. There's not the world's most robust market for cleaners. So we've been making sure that we get all the services needed to ensure that we can use these beds, turn them over, and then use them again. So we're making sure that we can adequately use all of our footprint and then scaling to demand.
Mm-hmm. I'm going to keep bringing in people into this section so we can kind of get to the part where you can all talk a little bit amongst yourselves. Eric Ares is manager for homeless systems change with the Home for Good team at the United Way of Greater Los Angeles, which put this call together. We just heard quite a bit about these sheltering efforts, but Eric, could you just come in and just talk a little about, what else is happening that the United Way thinks people need to know about?
Yeah, definitely. Thank you. A couple things we wanted to highlight are just and give updates on the city side. The city of LA is now operating 20 shelters that are opening up at Rec and Park sites across the city. That is through a partnership with LASA, service providers, Rec and Park, and a number of others. That total amount of beds is about 850 or so, which are essentially at full capacity at this point. Also wanted to just highlight that the City of LA and other partners are working hard to start opening up the state-provided trailers that have been provided to provide isolation and quarantine options for asymptomatic individuals who are high risk due to age and underlying health conditions. So those we are hopeful that they'll be operating soon. And another thing I just wanted to mention, and this is something that Meredith touched on around testing availability for people who are experiencing unsheltered homelessness. Starting this week in the city, there will be an increased amount of testing done for people who are experiencing unsheltered homelessness, particularly those living in encampments. This will include rapid results testing in a targeted way in coordination with a number of public and provider partners. And again, this will be very important in trying to identify just who might be contracting COVID while living on the streets, and how we most quickly can get those folks to isolation or quarantine sites or other resources that are appropriate for them.
Is there anything more specific you can say about that testing at this point, or?
Nothing more specific than that, but I just do it is starting this week.
Mm-hmm. And I want to bring in, before we kind of go to questions and follow-ups for all of you, Chris Freed, who's Chief Program Officer at LA Family Housing. Chris, you're working on getting people into emergency housing, which is something you were doing before the pandemic, but can you talk about what your role is here and how what you're doing now is different from what you were doing before?
Well, first, I just want to say thank you to the two plugs that we got from Meredith and Ian. Appreciate that. I think a couple of things, right? COVID really has highlighted the hundreds of disparities that our community basically has looked the other way upon. And now, given that we really have no choice because of the pandemic, we're finally treating homelessness like the humanitarian crisis that it is. And so a couple of things that I really wanted to lift up first is that, Meredith had touched on one of the things that Project Rootkey was able to do was to decompress shelter sites. And so LA Family Housing happens to operate on, in a normal era, a 250 person shelter that was already crowded. And so one of the first things that we had to do was to be able to decompress that site. And so we now, in addition to our one COVID positive site or a symptomatic site where people are actually showing symptoms, we have two other asymptomatic sites with a third coming online. When we opened the first one, we were able to actually reduce our density and provide people that had the greatest likelihood of, if they came into contact with COVID-19, of really having some poor outcomes, move those folks into these rooms. And so that's been pretty amazing. Things that we've done differently really is that it's amazing what we can do when people get behind this, right? The fact that we're looking at bringing on 15,000 rooms for asymptomatic people, another few thousand rooms for people that potentially are showing signs of some form of illness in such a short amount of time. Our first site, our COVID, which was our COVID site with that we partner with OEM, Department of Public Health, and Department of Health Services, virtually opened in 18 hours. We looked at the site on a Thursday afternoon at 2 o'clock, did a walkthrough. 8 o'clock the next morning, we were welcoming people in. We were setting up shop and ready to welcome people that needed a place to go. Our second site, we were made aware on a Friday and Sunday. The site was opened, and by Monday, completely filled. And the next site we opened was on that next Monday, and that was completely filled within 2 days. So we're really looking forward to bringing on this third site. We know it's making a difference outside, particularly to people that haven't had the opportunity to come indoors, and we're able to bring them indoors in a very, very different way. And I think this is what people were hoping for when Measure H was actually voted in, that we were going to be able to see a difference outside. And I think it's unfortunate that that it had to take a pandemic to get us to this point. But I think we have been able as a community to step up and show what we can do in a short amount of time when we have a concerted effort to do that. So I think those are the things. The one other thing that I would touch on is really around staffing. And that has been really around educating our own staff, how to protect themselves and yet still be able to do this work. Oftentimes the social service sector is forgotten when we talk about frontline staff. And we are definitely very grateful to our healthcare partners that are in the midst of this every single day. But our staff are also in the midst of this every day, and they're out there, and they care about the people that have often been forgotten. And so bringing staff on, having to really go through a different series of training. And additionally, as we're working with the DSW workers, so the disaster service workers, both the county and the city workers, it's been pretty amazing that we're taking folks that have never worked in this field, that may have come in with some preconceived notion about what homelessness was. And through us working together in teams, have been able to mitigate that. And really, it's been an amazing process by which we've been able to work with these other folks from different sectors and really bring them into our world and watch their transformation as they now interact and engage with people that are experiencing homelessness, and that we've been able to place in one of our sites. So I think those are really some key things that we're doing differently, spending a lot of time training folks on homelessness 101, so to speak, bringing them into the fold, teaching, having to really talk about safety and the way that we maintain our vehicles and those types of things, we transport people, and then just being able to stand these sites up very quickly so that we can bring people indoors and be able to then hopefully work very hard at moving these folks into permanent housing so that they do not have to return back to encampments.
Mm-hmm. I want to put to the group something that you touched on there, Chris, which is the idea that some of the things happening now, whether it's getting people into hotels and motels or new emergency options going up really quickly, should have happened years ago. I want to know what the rest of you have to say about that. And then also just with everything that is going on now, what do you think still is not happening that needs to? I don't know if maybe I'll call on someone to kick it off. Don't want to put anyone on the spot. Eric, do you want to start with this? And then please, just feel free to jump in and have a conversation.
I mean, yeah, just speaking to what Chris mentioned, I just think that, the urgency and the crisis has been there on our streets, and, with resources, with concerted effort, it's all the partners coming together and figuring out how do we take something that was already an urgent crisis. Obviously, it's unfortunate that it took this crisis to kind of create all these resources, but I think both the financial resources being made available, the coordination, and just the overall urgency has created for us what is a surge in the amount of resources we're building for our unhoused residents.
Anyone else want to weigh in there?
Well, this is Jacqueline. I think what's interesting about the pandemic is it's the one thing that threads us all together. whether you're housed or you're homeless. And we haven't had that before. Like when we've had other health outbreaks, it's been concentrated with certain groups, but the pandemic threatens all of us. And I think that that's what causes us to react differently in our response. So I would just say that we've not had that before. And so it's good that we take this opportunity to kind of equalize in what it feels like to house everyone and give them the services they need. So I think that's what makes this different. That's the silver lining of it all.
And that's Jacqueline Wagner. I haven't introduced you yet, but Vice President and Southern California Market Leader for Enterprise Community Partners, who's going to be joining us throughout the hour too. That's an affordable housing financer. We did get a question that came in from somebody who was listening, so I'll put this one out there. What about the safety of putting people inside one place like a shelter? Meredith, I know you were talking about doing appropriate spacing and taking measures like that, but I mean, how effective can that be? How safe is it? Can you talk about that a bit? I think you're muted. Oh, hey, Meredith, you're on mute.
Can you hear me now?
Yeah.
Great. I have to double unmute. So the first thing is that we're being really intentional about who is going into what we describe as congregate shelters, and that's where people are sharing a room or there are many beds in one room, and who is going into Project Room Key, which is single hotel rooms where there's only one occupant or a couple staying in a hotel room together. So for congregate settings, we're really looking for people who are not what we have deemed COVID vulnerable. These are folks who are younger, who don't have complex chronic health conditions, and who are presumed to be safer inside in a congregate setting. And then we are working, as I mentioned earlier, with all of our shelters to provide technical assistance through Department of Public Health and Department of Health Services to ensure that beds are spaced appropriately, that people aren't sleeping next to each other where both of their sort of faces are in the same vicinity, but instead sleeping head to toe. And then the big effort has been what Chris alluded to, which is pulling the really vulnerable folks out of those congregate settings and transferring them to Project Room Key, which is intended to help those really vulnerable individuals self-isolate. So again, working with our congregate shelter partners to identify the individuals who are 65 plus or have those chronic health conditions so that we can get them out of areas any area where they might be at risk for community spread. So in addition to decompressing our congregate sites and getting folks into Project Room Key from there, we're also mindful that, for example, dense encampments and people sleeping outside also who meet the vulnerable criteria are at risk for community spread. And so we're also working with our outreach teams to identify those folks and help them access the Project Room Key sites. So it's about being really intentional of where folks are going, putting the safety precautions in place to ensure that they can be safe when they come inside, and standing up as many of these sites as we can as quickly as possible to get folks inside.
Mm-hmm. And we have just a couple minutes before we'll move on to the next section, but I did want to just ask again, and see if you guys could speak at all to things that still need to happen in terms of this response that you're not seeing yet.
I would say that we need to focus on how, and I know that this will be talked about a little bit later, but how we move forward, how once this pandemic ends or we're deemed safe and we come off of the safer at home order, how do we keep this going? Because the one thing we don't want to do is work with folks that have been deemed the most vulnerable, particularly those that people of color that have been deemed in some of these encampments. We're working with a really large encampment like in Paxton in the San Fernando Valley that is primarily people of color. And I think that it's been documented, the data has shown across other parts of the country that, that those folks are most likely to have really poor outcomes. And so I don't want to have to open up the doors on, let's say, day 91 and say, goodbye. I think we need to really focus on what is the solution to either keep these going or some form of these sites so that we can really work toward solving homelessness at a much grander scale, and open the door for other folks that are outside to come indoors as well.
Mm-hmm. Well, anyone else want to weigh in there before Meredith? No? Oh, I thought I had a taker there.
Sorry, I was going to chime in. You're right. I'm on the double mute with Meredith. This is Ian. So yeah, I think Chris makes the really critical point. And I think, you know, in emergency management, usually you work in kind of isolated events and you move from the response phase where we are right now as a community and as a nation into the recovery phase. And recovery is, you know, how do we get back to normal? This is a unique event in a unique community where, you know, normal is not where anyone wants to go. We don't want to go back to normal. We want to stay in this new normal with the community we're serving here. So I know the county and the conversations are already beginning. The recovery in this case is part of the response. And we have kind of a longer lead time to that 91st day or whatever day it ends up being. But I know the county is already spinning up a very deliberate response and meetings that are on my calendar as soon as tomorrow to start thinking about these things and start talking about the longer term new normal and taking this crisis and taking advantage of some of the gains that we've made from it and making them real and longer term.
Mm-hmm. Well,
Anna, yes,
yeah.
This is Nina Womack. I'd like to make a comment around this subject. I am the executive director for Project New Life. We run New Life Global Development. We're a homeless housing provider. We're in the LASA building at 811 Wilshire on the 17th floor. What we are experiencing right now is our partners are calling us asking if we can house their former residents, because the homeless residents and reentry residents that had permanent supportive housing is now being pushed out of their housing back onto the streets because of this COVID-19. What's going on is the intensive outpatient programs that had funding support to pay the rent for these residents have now collapsed under this COVID-19 crisis. So they're no longer operating, so they cannot subsidize these homeless residents that had housing. So now they're being sent back to jail. 500 people have just been displaced. They were under our partners programs with CORE, also Helping Hands, and now they're calling us to see if we can put them in housing. So this is an emergency. It's kind of going backwards. So if, you know, we want to put out a call to action, if anybody who has funding support can help prevent the people that have already had permanent housing from going out into the street, like now, today.
Yeah. And that's the second order of business on this call that segues perfectly into what we're going to get into, which is this idea of prevention. You know, what about all the, not just people in permanent supportive housing, people who have lost jobs, who have lost income, who are very vulnerable right now. And Nina, I did want to start with you. You know, as you just said, you founded, you're a founder of Let's Be Whole. You're on the North Area Neighborhood Development Council. You're a small business owner. You also are someone who has personal experience here, and you are vulnerable yourself. Yeah. So could you just talk a little about your own experience and how you're dealing right now?
Sure. I'm an artist, a multimedia producer. I have my degree in theater. I'm also a social entrepreneur. And due to a domestic violence relationship about 3 years ago, that put me in a state of homelessness myself. One of my biggest fears was ever to be homeless, and that did become a reality. So thanks to LASA, thanks to Mark Ridley Thomas, I did hear about an opportunity that LASA was enrolling homeless people in CES. So I did fill out the application. It took me about 6 months to get housed, but praise God, I am housed now for the past year. So I'm recovering, getting back on my feet. By experiencing homelessness myself, that made me even more of a homeless advocate. I went and got trained as a peer mental health advocate. I'm on the front line providing food security, to my peers, to the homeless population, to anybody who is underserved throughout LA County. I've seen an influx in the increase of food right now. So bigger agencies than mine are calling me now. I work with the Department of Public Health at the Martin Luther King Prevention Center, providing food to their community on the campus of the Martin Luther King Hospital. I also work with DMH, and I'm getting just an influx of calls. Now I've just been appointed, like I said, executive director over Project New Life. So I will be a service provider providing holistic wellness services to our homeless population. And I'm very honored to be in that position because I understand what the community is going through. I give food to the homeless encampments almost daily now. We definitely need support. I do want to put out a call to action asking for anybody that we love the United Way, everyone in campaign, LASA, all the big agencies that are out here on the front lines helping, but please keep in mind and be cognizant of smaller agencies such as New Life Global Development, Project New Life, Let's Be Whole, my organization, who is on the front lines providing housing, providing food, providing mental health services that we need your support too, because like you said, everyone in, it's all hands on deck and all of us have to do our parts.
Mm-hmm. There have been a number of things coming down from the city and the county lately to protect renters who might be impacted by the pandemic and vulnerable. And it is all a little bit confusing. So I'm going to bring in Shashi Hanuman, the directing attorney for Public Council's Community Development Project. And Shashi, could you just run through what resources are available right now to help people who are renters who are worried about not being able to pay the bills?
Sure, Anna, thanks so much. And, the LA Times just reported today that half of LA County is unemployed. I saw the headline, I didn't read the article. So the question really is, how can people comply with the stay-at-home order if they've lost their income and they can't pay rent? And the city of LA, the county of LA, and the state have taken several actions in the past several weeks, very important actions that represent major victories for coalitions like Healthy LA Coalition to protect tenants. So as a result of those actions, tenants across the county, that is in all 88 cities of the county, are number one, protected against evictions during the state of emergency, and I'll talk about what that means. And number two, will have COVID inability to pay rent as a defense to an eviction action down the road. So under the state's Judicial Council order, which was adopted on April 6th, the Judicial Council sets the rules for the courts in California. No tenant in the state can be evicted right now unless necessary for health and safety. That also includes commercial tenants. And the state also took action with respect to foreclosures, which is not the subject of this training, but just so folks know. Eviction actions can still be filed, but they will not be processed until 90 days after the state of emergency ends. So that means no sheriff is going to come to your home to remove you from your home. You don't have to reply to anything that you get in the mail saying you are being evicted. You should still talk to an attorney. The city and county of LA also each enacted eviction protections for certain types of evictions, including no-fault evictions and inability to pay for COVID reasons, as well as adopting freezes on rent increases for rent-stabilized units in the city and unincorporated county. This means that if you are in a rent-stabilized unit in either the city or the unincorporated county, the landlord can't increase your rent for the period of the state of emergency. If your city has not adopted separate COVID protections, then the county protections against rent increases, the county protections against evictions, but not the freeze on rent increases will apply. So you should look to the rules of your city for more information. These actions don't mean that tenants don't have to pay rent. In the city and unincorporated county, tenants will have 12 months from the date the emergency ends to pay back rent. Now, there have been a lot of misleading claims about what tenants need to provide to the landlord to notify them they can't pay their rent due to COVID. Just to clarify, you don't have to provide bank statements. You don't have to disclose confidential medical information. You don't have to sign a repayment agreement or give up your rights. You do have time to speak to an attorney. Legal services agencies and local tenant unions are active and they can work with you remotely. You should provide notice to your landlord within 7 days if you can't pay due to COVID. You should pay rent if you can. And if you can't, you should maintain documentation attesting to your inability to pay. Now, the Judicial Council rule protects tenants for 90 days after the emergency period ends. After that period ends, tenants will be facing an onslaught of eviction cases. Not all evictions are covered by the local ordinances. So when the emergency period expires, tenants can still be evicted for breach of their lease, or if they can't prove their inability to pay is due to COVID, which is going to be especially hard for informal workers, or if you just don't have a lawyer to defend your case. So the freeze on rent increases only applies to properties covered by the county or city rent stabilization ordinances. There are no rent increase protections for non-RSO jurisdictions unless your city has passed something. And finally, rent is not forgiven under current law. The requirement to repay all rent down the road, especially for those already living paycheck to paycheck or below the poverty level, just puts these folks in greater debt and likely to be evicted or homeless down the road when we're living in a county where over 50% of tenants are already paying over 30% of their income in rent. So in terms of what's needed in addition to these actions, and I will say that our leadership and our advocacy campaigns have been incredible in terms of quickly acting to do things that are protecting tenants, but to provide real relief and to ensure the long term we're not creating more homelessness. We need to combine mortgage relief with rent relief. And we need to do things like City of LA Council members Ryu and Bonin have proposed, including a responsible banking ordinance, mortgage and rent forgiveness, treating unpaid rent as consumer debt so that unpaid rent can't be the basis for eviction, and a full unconditional eviction moratorium to close the loopholes in the existing ordinances.
Mm-hmm. Jacqueline, can you come back in here? Jacqueline Wagner popped in before with Enterprise Community Partners, which finances affordable housing. And could you talk about how the affordable housing sector is being impacted right now?
Yes, maybe I could step back because a lot of people think about Enterprise. They think about Enterprise, the rental car, not Enterprise Community Partners. We're a national nonprofit, and we really deliver grants and capital to build and preserve affordable housing, and we advocate for a policy at the federal and local levels. And really, our focus is advancing work around helping low-income families and people experiencing homelessness across the country. And what I think what the work that we're doing is important now is because our work is really human-centered. And I know one of the panelists mentioned earlier the need to talk about equity, but we acknowledge too that residents in low-income communities are most vulnerable at this time as we see people of color being disproportionately impacted by COVID-19. So to everyone on the line and everyone participating on this, we need to know that equity needs to be at the center of all of our recovery efforts. Mm-hmm. I was good to hear Sashi mention what came out in the LA Times, because ultimately, as Sashi said, that people won't be able to pay rent and buy food and cover their basic necessities. So what Enterprise does is what we want to do even more of is we help people build and finance affordable housing and preserve it. And our work also includes a number of systems change work. So we are really trying to help speed up people's access to housing. It was good to hear from Meredith at LAHSA. I'm also a LAHSA commissioner appointed by Supervisor Ridley Thomas. And I want to thank all those service providers and the United Way and other people on the front lines that are doing this work. But what I think the opportunity is for Enterprise as a longtime financer of affordable housing and permanent supportive housing is to elongate what we're using as short-term fixes. So making sure that people that are being housed through Project Room Key or in the rec centers and other places, that we take this and do something for the long run and build the supportive housing and services that people need. And we have a moral, like Chris said, we pretty much have a moral obligation to do so, and the pandemic is actually waking us up to focus on that. And I think what's exciting about that's happening during this pandemic is, you know, enterprises always partner with people to come up with solutions, but I think we need to all double down on that. Many of the people on the line were in active conversations. I want to applaud all the advocates that have really got the local leaders to say that they're going to prevent evictions at the state and local level. So our leaders are stepping up for us. But I think that Enterprise's focus is making sure there's some exits for folks after they are in these short-term solutions. So we're working with the state and our local leaders to look at capital solutions so that we can see where we can house people, whether it be in the hotels, looking at publicly owned land and other strategies so we can build the housing we need.
Mm-hmm. So we've reserved some time, and before the hour's up, I do want to move to the third section where we've set aside time for a couple of people from the United Way who put the call together and are behind the Everyone In campaign to talk about their work right now, starting with Carter Hughley, who is Director of Homeless Initiatives with the United Way of Greater Los Angeles' Home for Good team. Carter, could you just generally kick us off here and talk about what the organization is doing right now that you would like people to know about?
Absolutely. Thank you, Anne. And pivoting off of what Jacqueline was just saying, you know, the number one thing I think we're focused on, and Tommy will talk about, is advocacy, because what's true today is what was true before this, which is that our clients deserve a home. So we're advocating for the resources necessary and the policy changes necessary to make sure that everybody we bring inside stays inside until they're connected to a permanent home. But in addition to that, we're concentrating on funding through our pandemic relief fund and using those resources to provide supplies to our partners. We particularly know, and I appreciate the questions about how we're working to make sure that we're thinking about the disproportionate impact on people of color. We are trying to make sure that, you know, not every organization has grant writers and people who have the time to sort of apply for funding. So we've made really low barrier applications, and we're following up with organizations that we know are led by people of color and are serving people of color to make sure that they have ample opportunity to apply for those funds and are getting those funds. And we actually prioritize our early funding for organizations that we know we're serving our highest needs areas with the highest density of clients who are unhoused. So we're really working on getting fabric face masks, thermometers, really like life-saving supplies for our clients out to those providers on the front lines. And then the third thing we're doing is augmented coordination. We know our government partners like LASA and county and the city are doing heroic work coordinating everyone. So we're just trying to work with them on food security issues, healthcare integration issues, because the whole healthcare system for our clients, which we know disproportionately struggle with some of these underlying chronic diseases, we're trying to make sure that we're coordinating ongoing healthcare for them to make sure that they continue to get their needs met. Food security, as I mentioned, procurement of supplies and goods. So anything we can do to help coordinate those efforts, we're trying to do right now.
Mm-hmm. Tommy Newman, can you step in here as well? Tommy is Senior Director of Impact Initiatives, also with the United Way of Greater Los Angeles. And I was wondering if you could just piggyback off of this question about what's going to happen when this pandemic subsides, and you know, what needs to happen to make sure that people who are getting indoors now aren't just dropped when this is over. I know that's something you've been focused on.
I think it's the other side of this coin, and we need to be able to think about both of these at the same time. We need to be able to think about the emergency response. We need to think about how we are preventing people from falling into homelessness, and we also need to be thinking about where we go from here. And we should not wait weeks or months to figure out where we go from here. And so we at the United Way are certainly not waiting weeks or months, and we see this conversation happening right now across the region, and it's the right one to have. If we're going to move thousands of people into hotels and motels, then we need to have a plan so that those highly vulnerable people do not go back to the streets, because that's unacceptable. Until there's a vaccine, nobody's safe. There are 15,000 people across LA County who are experiencing homelessness right now who are especially vulnerable to this virus. And that's a mix of people who are over the age of 65 or have chronic health conditions. So if that's the universe of people that we know already do not have the stability of a home, then at minimum, our solutions need to be at that scale. But we know that when we add in the hundreds of thousands of people who are at risk of losing their homes because of unemployment increases and everything else, we need to be looking at solutions at that scale. So we've really been focused at the United Way with a lot of our advocacy partners on the federal funding that has been approved so far. There's a pretty significant amount of funding that was approved by Congress in the last package. We need to make sure that that goes to benefit the people who are most vulnerable and the people who need it the most. And so I think we need to have a shared value across this county that the 15,000 people who are incredibly vulnerable in this moment need to be connected to safe, stable, permanent housing. And so how do we do that? That's probably a mix of, excuse me, purchasing hotels and motels with these federal funds, purchasing apartment buildings that are at risk of going into hands that wouldn't look out for the people who are those tenants, and also help people who need those apartments that they can afford get those apartments. We need to look at creative solutions around public land and using modular housing and prefabricated housing and getting that stood up on public land as quickly as possible. This is the moment to be doing that. And we know that Congress in the past and Washington, D.C. has stepped up and funded solutions like this in moments of emergency. Of course, we should have been funding it all along, and it shouldn't take a pandemic for us to convince the federal government that this is the right investment to make. But we're seeing money approved, and we know that more is out there. And so we need to come up with the solutions, build consensus, and move quickly, which is really a focus of our Everyone In campaign, which hopefully a lot of folks who are on the line are already a part of. But if you're not, I hope you'll sign up at everyoneinla.org because we will be working hard to elevate advocacy opportunities for regular folks to call, text, tweet, email their elected officials and say, we need to make sure that the 15,000 people who are most vulnerable experiencing homelessness are guaranteed a permanent housing slot going forward. So that's a real core focus for us right now at the United Way and a lot of advocacy leaders across this region.
Mm-hmm. So with the little bit of time that we have left, people have submitted questions and we pulled a few that we'll put to Carter and Tommy to answer as best they can. The first one is from Susan in La Crescenta. She asks, are outreach workers safe? We know that outreach is still going on. We talked about that a little earlier, but are they safe out there? Carter, could you address that?
Yeah, sure. So outreach is absolutely still happening. We estimate that we've already brought in roughly 1,500 clients from the streets into some sort of either safe congregate shelter or isolation and quarantine. And I think the number one thing we're focused on is, yes, keeping our outreach workers safe, but also keeping our clients safe from exposure through outreach. So we're working on PPE for the outreach workers who are now doing that at using safe social distancing practices to make sure that, yes, that they are safe, they remain safe, and that we're not in any way contributing to the spread of this virus to our clients.
Mm-hmm.
And I think that's, just to chime in there, that's why we love, if you have the ability to support our pandemic relief fund. You can see on the slide now if you're watching on Zoom, otherwise I'll just share it, pandemicrelief.unitedwayla.org. The outpouring of support for this fund has been really overwhelming for us at United Way, and these dollars and the support that we're receiving is being used to purchase that PPE, those masks. We purchased over 200,000 masks with that funding because we're able to buy in bulk. We've then been delivering that to over 100 community partners so that they have those masks, so that when they're working with their clients or able to share those with their clients, we're able to get this protection to people who really need it the most and are having trouble accessing it.
Mm-hmm. There's another question here from Gia in Inglewood. She wants to know how she can help besides staying home. Tommy, do you want to?
Yes, staying home is important. So we appreciate Gia and everybody else doing that. On the slide here, you can see we have a couple options. We have online workshops as part of our Everyone In campaign, which are opportunities for people to be able to come and ask questions like the ones that are being asked here today, but not with potentially thousands of people. They're usually a little more intimate, 10 to 30 people, and an opportunity to have a conversation with one of our community organizers and better understand all of this, because I know that it's overwhelming and confusing and feels like such a massive challenge that it must be unsolvable. But we're here to help sort of break it into smaller pieces because it's absolutely solvable. And so sign up for one of those workshops, everyoneinla.org/events. You heard my call to action on guaranteeing the 15,000 most vulnerable people safe permanent housing going forward from here. And so we need your help reaching out to elected officials. And then we are a partner with the Healthy LA Coalition, which is doing great work building awareness and pushing for protection for the hundreds of thousands of people who are most vulnerable. All of that can be done from the safety of your couch or kitchen and does not require you leaving your home, and all of that would make a huge difference.
Well, the last question, there's one more time for one more here. This is from Jessica in Lancaster. Has the priority shifted from permanent housing to temporary housing? As a person with lived experience, we should not have to go from temporary housing to unhoused when this is over. Carter, could you address that?
Yeah, we couldn't agree more that you shouldn't have to do that. And every partner that we're working with strongly agrees that once we bring people inside, we should keep them inside if that's where they want to be until they're connected to a permanent home. Our government partners have absolutely still continued to connect people to permanent housing through online applications, electronic signatures, self-certifying inspections. So if someone is able and is already sort of in the pipeline to go into permanent housing, that is the priority. But as everyone has spoken to, we have to do both. And so they are moving heaven and earth to open these temporary housing sites so that we can bring people safely inside as well. So it hasn't, yes, it has made us move mountains on the temporary housing side, which we're hoping leads to permanency, but we continue to focus on getting people connected to permanent housing.
Mm-hmm.
Anna, I'd like to make one comment about advocacy and getting involved. After experiencing my homelessness, I joined a local neighborhood council. I'm in the North Area Neighborhood Development Council. So now I have a voice of advocacy to make sure that affordable housing is taken into consideration as these developers come into the community. So you guys, I want to encourage everyone to look up your local neighborhood council, attend the meetings once we get back into the swing of things, and get involved in your communities.
Mm-hmm. Well, thank you for that. And yeah, thanks to everybody who has been part of this, all the panelists, also everybody that's just joined through the Zoom or called in. Appreciate it. Hopefully it's been informative and helpful. If you RSVP to this through the everyoneinla.org website, they'll be following up with you through email. And they also do plan to do another call like this one in the future. So look out for that. And until then, everybody just stay safe and healthy as best you can. And thank you so much.
Thank you, everybody.